Imagine receiving a diagnosis for a mental disorder. For many, it's a moment filled with uncertainty, questions, and even fear. What comes next? In today's discussion, we will explore what typically occurs after receiving such a diagnosis, delving into the steps one might take, the decisions faced, and the support systems available to navigate this journey. Receiving a diagnosis of a mental disorder can initially feel overwhelming. It often comes after a long period of experiencing symptoms without clear understanding or a name to attribute them to. The first step following a diagnosis is often consultation with a mental health professional. This can be a psychiatrist, psychologist, or therapist who will help to interpret the diagnosis and outline a treatment plan tailored to the individual's specific needs. It's crucial to understand that this diagnosis is not a label, but rather a guide to understanding and managing one's mental health more effectively. Communication is key in this initial phase. Working closely with your healthcare provider involves asking questions about the diagnosis, understanding what it means, how it might manifest in daily life, and what symptoms to expect or watch out for. This is also the time to discuss any concerns about treatment options, such as therapy, medication, or lifestyle adjustments. Once the diagnosis is understood, the next phase often involves exploring treatment options. Therapy, and particularly cognitive behavioral therapy, is frequently recommended. It's a process that can assist individuals in understanding thought patterns and developing coping strategies. In some cases, medication may also be prescribed to help manage symptoms. It's important to approach this aspect with patience, as finding the right medication and dosage can take time and adjustments. Living with a mental disorder diagnosis is not a solitary journey. Support comes from various avenues, and building a support network is essential. Family and friends can provide emotional support and encouragement, helping to reduce the stigma often associated with mental health conditions. Support groups, either in person or online, offer safe spaces to share experiences and advice with others who truly understand. Additionally, many find great benefit in educating themselves about their condition. Knowledge is empowering. Understanding more about the mental disorder can demystify symptoms and treatment processes, making the situation less daunting. Books, reputable websites, and discussions with healthcare providers are excellent resources to explore. A diagnosis can also prompt lifestyle changes aimed at improving overall well-being. Regular exercise, a balanced diet, and adequate sleep are foundational elements that can positively impact mental health. Mindfulness and meditation practices can help to manage stress and improve focus. These habits contribute to a healthier lifestyle, which can aid in the management of mental illness. It's important to acknowledge the emotional impact of receiving a diagnosis. It may bring relief, validation, or it may be accompanied by feelings of denial or sadness. Grieving the diagnosis is a normal response. Mental health professionals can provide support during this time, helping individuals work through these emotions and begin to see a path forward. Stigma surrounding mental illness is a significant barrier many face. Understanding that a mental disorder is a medical condition, just like any physical ailment, is vital. Advocating for oneself and seeking support without shame can help break down these barriers. Finally, remember that recovery is a personal and unique journey. For some, it might mean managing symptoms effectively. For others, it might involve significant transformation and growth. The path is not linear, and setbacks can occur. It's essential to maintain hope and remain committed to the treatment plan, adjusting as needed. In conclusion, being diagnosed with a mental disorder is a pivotal moment, but it is also the starting point for a path towards understanding, managing, and potentially thriving despite the challenges. With the right support, treatment, and personal commitment, individuals can navigate this journey towards mental wellness. The process may be challenging, but it is filled with opportunities for learning, growth, and connection. Remember, you are not alone, and help is available every step of the way.